So I'm here with Craig this morning, and Craig here is for the re-examination. And so Craig had his left knee replaced about 3 years ago, and then his right knee was going on the way to being replaced, and then he decided to do the stem cells. So Craig, take us from where you were 3 months ago to where you are today in your right knee, which was not replaced, and then your left knee that was replaced.
On the right knee, I was having a small amount of pain just daily, and the more I was on it, the more pain I had by the end of the day. I came to the stem cell seminar, and it sounded really interesting, but when I talked to Dr. Patrick at the end of it, he told me about a gentleman that had a knee replaced and was needing the other knee replaced, and they did a partial injection in the one that had been replaced because he was having some issues still with it. So that kind of interested me because I was having some aches and pains in the one that had been replaced. So I decided to do it, and now it's been 3 months and I'm back from my first follow-up. And my right knee, which was going to need to be replaced, I've got no pain anytime during the day or even after a full day on it. On the left knee that was replaced, it's much better. Right now, if I'm sitting like I am here on this table, I have a little tightness on the left side, and at the end of the day, it might turn into an ache, but that's probably 5 times better than it was before the injection. So at this point in time, I'm a happy camper.
Awesome. And did you tell me before a couple minutes ago, Craig, that you were rubbing cream on your legs nightly for the pain, and you no longer have to do that?
Yeah, and as a matter of fact, I even had to do that a little bit after the injection. It seemed to be a while for the injection to work, and it was only about a month ago or 2 months after the injection that it really seemed to be working, and now it's just great. So the last month has been great.
That's awesome. And then would you recommend the stem cell procedure? We just talked about a couple of referrals you're going to send over.
Yeah,
would you
I was a
recommend
little
it?
hesitant there for a while, but then this last month kind of put me over the edge. So yeah, I've got a friend and a relative that I'm going to recommend.
Awesome. Okay, Greg, great to see you again, and I'll see you in your next follow-up.
Uh-huh.
Thanks, Greg.